Hello, my name is Tom Gellhaus. I am an OBGYN in the Department of Obstetrics and Gynecology at the University of Iowa. I'm also the 67th President of the American College and Congress of Obstetricians and Gynecologists. My role as ACOG President is to represent our members and our patients throughout the United States and around the world. Well, I was very fortunate throughout my life to have many great role models and also to have many great mentors, as I would say. My father was a great inspiration. He was very involved in politics in South Dakota, starting in the City Commission and Planning Commission and then working into the state legislature. And that was something that was very important to our family and really stuck with me and was an interest all my life. I was also very fortunate to know a lot of OBGYN professional leaders, and those people were not always official mentors, but maybe unofficial mentors, in that I was able to follow them and their examples. They were the ones that encouraged me each step of the way to take that next opportunity as it arose, and I'm very fortunate that they pushed me and encouraged me to do those things. Another important role model, and really sort of a fun fact, was in Yankton, South Dakota. There was a physician named Brooks Ranney, and he was an OBGYN and was a president of ACOG in the early 1980s, and he truly was an inspiration to many of us in our community. I am very passionate about this organization because of all it does to improve women's health. And we do it through a multitude of different avenues. One of those is education and our educational resources, not only for our members, but also for our patients. We also work in the area of encouraging research. We have a journal called Obstetrics and Gynecology, or as we call it, the Green Journal, which has probably one of the highest impact factors now of all journals that are published. There are several focuses that I have taken on in my president year. One of those is advocacy, and I want to work to help engage our members in the advocacy process. I want to teach them the importance as well as the impact that we can have as a unified voice. And I also want them to understand how easy it is for them to be involved in this process. There's always a saying that we use in advocacy at ACOG, and that's, if you're not at the table, you'll be on the menu. And what that really means is that if we are not there as a unified voice, negotiating for the needs of our members and the needs of our patients, there are many other organizations and special interest groups that will be happy to do that. And they'll do that without understanding the day-to-day reality of what our members go through and what our patients go through. The other area that I am working on is in the area of global health. In the early 90s, our family became involved in short-term surgical mission projects around the world. And there are many of our members who are very interested in participating in these shorter 2-week projects. Many OBGYNs cannot leave their practices for months and years at a time to help people in the world. And so what we're doing is we're developing a database of OBGYNs who are currently involved in projects around the world. And then we're going to integrate that so that our members can identify who may be even in their own hometown who's already participating, so that they can contact them and get involved. There is an incredible workforce shortage developing for OBGYNs. By 2020, 6,000 to 8,000 OBGYNs will quit or retire. By 2025, there will be approximately 15,000 that will retire or quit. That number of OBGYN residents will exceed by 20% the number that are coming out of their training programs. We need to look at better ways and maybe shorter ways or different avenues to train our residents to get them out into the practicing world. These type of initiatives will have more of an intangible effect than a tangible effect or change in clinical practice, and the hope is that it will get more people involved. It may help with some of the physician burnout that we're seeing, especially in OBGYNs, and by being able to go out and do some of the projects, be involved in advocacy, that it may give them another avenue of interest and help take away that risk of burnout that we're seeing. My feeling is that the work that I'm doing now will come back to Iowa in that I hope that I can be an inspiration to other medical students, residents, and faculty, and that they know that they can get involved and that they know that they can make a difference, and that if I can do it, anyone can do it.